people are confused about ophthalmology versus optometry. So in Singapore, an ophthalmologist is an eye surgeon. An ophthalmologist is someone who has gone to medical school and has a medical degree, is a doctor by training. After medical school, a person needs to go into ophthalmology training, which will take a few years to become a specialist. So an ophthalmologist is a medical doctor who has attained specialist accreditation and specialist training to become an eye specialist. That's an ophthalmologist. This means that this person is quite well trained and will be able to actually diagnose, treat and manage all eye problems, including laser procedures, surgery and all investigative procedures. The difference for optometrists is that an optometrist is not a medical doctor. An optometrist is someone who actually goes through a training in optometry, which is the field. In Singapore, it's actually a diploma degree or and in some cases a bachelor's degree. They didn't go to medical school. It's they went for a degree or a diploma program that specializes in eye care. Basically, I would consider it like a primary eye care. Okay, they are taught to screen for diseases, and they concentrate a lot on refraction, like checking the power of the eye. I would say that they would be better at checking like the power of the eye, just general eye screening, but they may not be so qualified to treat eye diseases that, especially those that need surgery, because they're not medical doctors. Having said that, I do not think of these two as so diverse because they should work together as a team. For example, in my practice, I have actually the full range of eye care professionals. We are just eye care professionals, but in a slightly different way, with each of us having different roles. So in my own practice, I have an in-house optometrist as well, and I also have other eye care professionals like orthodontists, which job scopes are very different. So overall, in my practice, the ophthalmologist like myself, the eye surgeon, it's the overall person in charge, but for each investigation or each part of it, there could be a different eye care professional involved. So the take-home message is that an ophthalmologist is actually a medical doctor that has subspecialized in eye care so that they can look after all aspects of eye diseases, especially with treatment, using medication, using lasers, using surgery. An optometrist is someone who does more primary eye care, screening and checking the power of the eye. Optometrists, of course, can also run their own practice. Instead of practicing like together with the ophthalmologist like myself, they can run their own optical services and where they dispense glasses as well. Singapore is a very sunny place, so there's UV light everywhere when we go out. UV protection is very important for our eyes because besides damage to our skin, which we know, for the eye itself, besides the eyelid skin, to excessive UV light can damage our eye. The lens, it increases the cataracts and sort of cataract, and UV light can also damage the retina and increases our chances of getting macular problems. So I would say in a place like in Singapore, we should, actually when we're outdoors, should actually wear UV protection, and it's important to look out for, it's not just how the sunglasses look or how dark the tint is, actually how much protection it gives you. So look out, make sure that your sunglasses are protecting you against blocking out UVA and UVB light. So that's very important. The other aspect of UV protection is that with myopia, for young kids, we actually actively advise them to go outdoors because outdoor sunlight has been shown to have a protective effect for myopia. All the more because they need to go outdoors, they should not forget their UV protections too. So for a lot of my patients, even young patients, I remind them, you have to go outdoors because you don't want to be myopic, but at the same time, remember your UV protection. I usually give my patients a lot of eye care tips depending on the age of the patient. So for younger patients, I would advise them to, cut down on unnecessary near-work iPhone, iPad, computer games, because and to go increase outdoor play so that it will reduce the risk of myopia for them. And of course, avoid trauma. A lot of kids, when they play, they forget and then they hurt each other's eyes. So I always tell them to take good care of their eyes, take good care of their glasses. For older patients, I actually generally advise them to control their diseases, because things like diabetes, thyroid problems, hypertension, all can have significant effect on the eye if it is not properly controlled. So they have to control their whole general health first, and then for the eye health itself, regular checks will be good so that we can diagnose any problems. And it's important to remember that any diseases, when picked up early, will be more amenable to treatment. Especially in young children, there's this thing called lazy eye, which means that, for example, if an old patient develops a cataract, they can have the cataract surgery anytime because the vision is already formed. It's just temporarily lost when the cataract is there. And once you do the surgery, you will restore the vision. It's different with the children. For children who are born with, let's say, congenital cataracts, if you delay the surgery, the child does not have a chance to develop normal vision, and they get very, very bad vision called lazy eye. That's why for children, I always tell them that they must not forget that time is extremely important, because the child's vision is constantly developing, so they cannot miss the boat and delay treatment. So eye problems, especially in children, need to be picked up very early. And the last thing is always believe in science, and you can read up on eye care matters, or attend healthcare talks, or watch our video.